Hello, it's Andrew Colsky again from Stop My OCD, and I am excited today. We have Rabiia Ali. She's coming all the way from Sacramento in California, and I'm over here in Virginia, so we've got a big time zone difference. Rabiia is going to talk with us today about some anxiety issues and some PTSD issues. So, Rabiia, could you introduce yourself to the audience?
Yes. Hi, I am Rabiia Ali, and I am a licensed marriage and family therapist. I have been practicing for the past 7 years now, and I've been licensed for the past 3 years. I am in private practice, and I own a nonprofit, which is called South Sacramento Mental Health Collaborative. And that's pretty much my whole life right now is the work that I do. I'm trying to get more into a couple of other programs, but for the most part, my specialty is trauma recovery, and
Mhm.
I work with a lot of clients who have PTSD diagnoses or anxiety diagnoses. I haven't necessarily worked directly with anyone who had an OCD diagnosis, but I am familiar with that as well.
Mhm.
But the clients that I work with daily generally have either PTSD or complex PTSD diagnoses.
Great, great. Well, that's certainly a very specialty area that needs people who know what they're doing, and I'm glad that you're doing that. Before we get started with questions, do you have a website if people wanted to look you up?
Yes, it's www South SOUTH like Sacramento SAC M like Mary HC.com.
Fantastic, wonderful. Thank you for that.
Thank you.
So let's get into the nitty gritty here. So,
Yes.
one of the first things I'd like to talk about, we talk about this is started off as an OCD channel, but because anxiety disorders and PTSD and several other things are so relevant and in the same realm, it's hard to talk about one without talking about others.
Right.
So, you and I were talking about some anxiety issues before we started the podcast here. So, can you tell the audience what is your experience with anxiety?
So I've never been diagnosed with anxiety. But, as I was saying, I have medical anxiety because of some of the experiences that I've had in the hospital. So anytime that I have to do anything that has to do with the doctor or going to the hospital, my anxiety and my blood pressure raises. So recently I've had an experience with a hypertensive episode, and I was in the ER 3 times because of it, and it was, kind of written off as anxiety, even though my blood pressure was really, really high. Like, the first time I went in, it was 200 and I think 213 over 120, I believe, something like that. And that's not the first time that that's happened. I've had, high blood pressure since I was 25. And so a lot of times when I go in, I get treated as if, I'm just somebody who just needs to get pumped with medicine and leave. And they medical professionals usually just fix the symptom and then send you on your way, but there might be an underlying issue that no one is really paying attention to.
Mhm.
And so that brings me a lot of anxiety because I can't trust the people who are supposed to take care of me. And it makes it difficult for me to just live normal life because, I have all of these things going on. But for me, it's not normal for someone that's 25 years old to have high blood pressure. And a lot of times it's racially motivated, if I can say that,
Mhm.
because people assume, my diet or because I'm African American or because, that's hypertension is one of the things that supposedly African Americans have, that's just what it is. It's just because she's a black woman and, that's what happens. But 25-year-olds should not have high blood pressure.
Right.
And so I've been taking medication since I was 25. And a lot of times I stop taking my medication and then my blood pressure skyrockets. So it's only controlled, right? There's something happening, but no one is really paying attention.
Right.
And so that brings me a lot of, I have panic attacks myself sometimes. And like I was saying, I feel like at times, because I'm a therapist and because I'm helping people through these issues, that I feel kind of inauthentic at times because I am experiencing this myself. And I'm also going to work and helping other people to get through it. So it's like,
Right.
how people say, how can you tell someone something that you haven't overcome, right, yourself? And it's kind of difficult to um, be in that space because I haven't been able to figure it out.
Mm-hmm.
But then at the same time, I can understand and I can empathize with clients who haven't been able to figure it out. And I'm not rushing them to, get through their treatment because I understand how difficult it is.
Right. Right. Wow. So it sounds like, prior to you dealing with this for yourself, that here you are working as a counselor, you've got patients coming in, some of them dealing with their own anxiety issues, you're treating them, then you end up being sort of the patient, and
Right.
the tables get turned on you. So what lessons, if any, have you personally learned about anxiety, people seeking treatment for anxiety, any types of issues related to that? Share with us, the benefits of what you've learned.
Well, one of the things that I understand now is that people shouldn't be written off because they're having panic attacks. It shouldn't be, it's all in your mind. I mean, I've never really felt that way, but I know that there's a lot of, like we were talking about the stigma, there's a lot of stigma around it because it's, why am I experiencing this? And I could just figure it out, right? I can just handle it. I'm just supposed to stop, thinking this way, or I'm just supposed to breathe, or I'm just supposed to, work my way through it. And it's not that easy to do. It's very difficult to feel anxious because what I've learned, being a therapist is that you feel anxious because you're going to be anxious. Right? It's the cycle
Right.
of the anxiety. You feel something in your body and you're like, "Oh my god, this is getting ready to happen." And so that brings on the anxiety that you might not have had that thing or that feeling or that whatever physiological response was happening wasn't going to happen. And so it's difficult for people on the outside that are external to be like, or to understand, why is it that you just can't stop doing this? Why is it that you just can't stop thinking that way?
Right.
Why can't you just figure it out? Because, mind over matter, I hate that
Right.
saying so much.
No, I mean,
I
that's
hate it. I hate
that
that so
concept.
much. Yeah.
You
So
know,
it's
we
not, go ahead.
no, I was just going to say, we hear that concept so much, whether it be related to OCD, whether it be related to anxiety, whatever it may be, well,
Right.
why don't you just stop it?
Why
Well,
don't you just
oh,
stop?
what a great
Yeah.
idea. Sure. Oh, look, I'm cured.
Right. If I could, don't you think I would do that? Yeah. So it's like, I being a person who has experienced it and now dealing with people who are in front of me who are experiencing it, I never get to a point where I'm like, oh, you can just think differently, even though, CBT says, change your thoughts, change your actions, change your feelings, that type of thing. But it's not really that simple. You have to come at it from a holistic approach. You have to have a medical side and you have to have the mental health side and you have to have support, right? There's all kinds of things that are involved. And if you don't have one of those things, it may be difficult for you to overcome it. And sometimes it's written off as
Mhm.
anxiety when it might be something else. And so then you start to question your reality. Like, I'm being gaslit by medical professionals every day. Like I know that there's something going on. Why is it that you're not seeing it? Why is it that you're not looking at what is happening? Yes, anxiety's there, but there's something else that's happening.
Yeah, and you raise an important point there as well, which is, you know, when I look back at my own schooling and training about anxiety, so much of what I was taught is about treating the symptoms rather
Right.
than treating the underlying disease, whatever that may be.
Right.
And, you know, yes, there is a place and a benefit for treating symptoms. There is a place for breathing exercises. There's a place for many of the things that we teach. But if we're doing that exclusively and we're not getting to the core issue, what's driving that anxiety, then
Right.
we're not really, giving the patient the true benefit that they need to have.
Hmm.
But that's hard because it takes a lot of analytical digging and thinking and processing and trying to work with them as they figure it out. We're not figuring it out for them, but we're helping them
Right.
along that way. um and just it's such a timely topic for me because personally I've been recently doing a lot of reading of a lot of the research journals and things out of NIH about anxiety. And I've been trying to kind of map out for myself what's really going on here, what part
Hmm.
of the brain is involved and what's happening and what chemicals, what neurotransmitters. So it's just, you know, more than other people I'm sure are interested in, but it's just something that interests me.
Yeah. Yeah. I am interested in that as well. And the thing that a lot of people don't understand is that people who have experienced trauma, their brains and their neurotransmitters don't react the same way as someone who hasn't. So they don't develop what will be considered normally, right? So you expect normal reactions from people who don't have or haven't experienced normal development, normal brain development. Like their brains are literally wired to survive their everyday, right?
Hmm. Hmm.
And so it's difficult for some clinicians, and I've known a few, to treat people who have those types of issues with, with cognition or with their level of development, because they can't educate them through it,
Yeah.
right? It's more of a, there may be something else other than psychotherapy that they need to get help. And a lot of times, because we're not, versed in that, or we're not well versed in something else, we may not understand that this is not the only thing that's going to be able to help them.
Yeah. And it's, I think back to my own experience, and I come from a family of medical doctors, and their training is if you have these particular symptoms, you give this particular pill. And
Right.
as far as they're concerned, they've done their job. And to me, I'm like, well, that's nice to treat the symptom, but have you thought about what's causing it? And
What's the problem? Yeah.
right, and when it comes to mental health disorders, it's an important question. And that's where my interest lies, is what's really going on here for someone.
Mhm.
And
Mhm.
so you raise the issue there of trauma and all, which is a really interesting area all by itself, yet also very relevant. I have many patients with OCD or other things who also have trauma, and what I found is that if we don't treat the trauma first, we can't really treat the OCD or other
Right.
things. So
Right.
you've got a lot of experience with patients with PTSD. I'm really curious, how did you get into that? Tell us about your background and what got you treating patients with PTSD.
Well, before I was even a therapist, or before I even decided to be a therapist, I started a mentoring program back in 2000. I think it was 2010 is when I started. But had been working on it since like 2007, because my oldest daughter, had some issues, behavioral issues, and she had experienced some sexual trauma.
Mhm.
And I was trying to get a program in the area that we were living in, like a support group, or, some type of youth program to help her with the issues that she was having. And there was nothing there. So I'm a person of, if I can't find something, I'll do it myself, which sometimes is to my detriment, right? But so I started this program in 2010, and it was for young girls at a specific well, it was like a middle school, high school hybrid program. And so it was after school, and it was like a support group for them. And I had, the first year I had 16 girls, and the second year I had 13, I think it was, or 14. And the first
Wow.
year the 16 out of the 16 girls, 15 of them had experienced sexual trauma before they were 12.
Oh my gosh. Wow.
Yeah. And so that got me to thinking, like, what is happening here? Because at first I thought it was just going to be, I'm a mom and I'm, helping these girls, and I'm just, we're just doing stuff after school. And then it got to the point where they started to talk about things that I couldn't help them with because
Mhm.
I didn't understand. I wasn't educated in that. I did understand from my own perspective because I have experienced it myself. So, having that personal experience, I thought I could relate to them, but they were dealing with things that I couldn't help them with, right? Like when we are in school and we're learning about closing, I didn't know how to do that. When they're crying hysterically, I'm like, only thing I can do is console them, right? But I didn't know how to get them to a place of where they would be mentally okay.
Mhm.
And so I decided, okay, so since I don't have any degrees and I don't have any letters behind my name, I'm just going to go ahead and go back to school. And I got my master's um, after that in 2017. And so after I did that, I was like, okay, I'm going to go back to the mentoring program. But by that time, all those girls were adults.
Right.
And so
Right.
I was like, okay, what do I do now? Because I didn't know if I wanted to start with a new group or whatever happened. So while I was in school, I became an alcohol and drug counselor at a treatment facility. And then I started working with the perinatal alcohol and drug program. And so I started to see that I wasn't good at being an alcohol and drug counselor because I am a person who looks to the core of the issue. And that is also a symptomatic treatment, right? You treat what is happening on the surface. And I was always like, there's something else going on. Like, and then I started to deal with families that were involved with CPS.
Mhm.
And that got me to thinking, like, what is going on here? Why is it that these things are happening? Why is it that these families are experiencing these things? What is happening on whatever level, to where they're coming in here and they're having to be treated for alcohol and drug issues, but they also have this thing going on, right? And so I started to do a lot of research on that. And I ended up being or learning about more about trauma and more about what happens and how it affects your brain and what goes on with people who are experiencing that. And so that's kind of how it started. And then suddenly my name got out there and everybody who was experiencing trauma was like, oh, I can see you. And so that's kind of where I got the clientele from. It's just based off of me having that thought process of whatever this is that's going on, this is not the thing, right?
Right.
This is just
Right.
a symptom of the thing, whatever the thing might be. And the thing usually ended up being something traumatic. And it ended up most of the time, especially with women, being sexual trauma.
Wow.
So, yeah.
Mhm. I'm sitting here thinking to myself, it's really good that there's people like you who got the training and know how to deal with it and are out there and available. But at the same time, it's a double-edged sword. It's sad that people like you need to exist because we
Right.
have all the trauma and things.
Right. Right. Yeah. Because and I always say this, and this is something that people often think that is strange about me, but I think the messaging sometimes is wrong when it comes to issues with sexual trauma and things like that. Like sexual assault and, rape and those types of things. I think the messaging is wrong because we always blame the victim. We
Mhm.
always we always we always educate the victim on how to not be a victim, right? But we don't have any programs for perpetrators, right? We don't have
Yeah.
anything to treat the perpetrator. We don't treat the source. We
Right.
don't treat the core of whatever the issue might be. And we continue to have to treat women who experience it, but we don't necessarily, or not just women, but people who
Mhm.
experience it, but we don't treat the people who are perpetrating the crime or the
Right.
issue. And
Right.
sometimes it's not a crime, which is another whole nother subject, but we're not treating the perpetrator.
Right.
We're not focusing on the perpetrator. We're just putting them in prison, or we're, keeping them locked up for whatever, you know, reason, whether it's mentally or physically locked up, but we're not giving them treatment. We're not
Mhm.
trying to figure out what is the core of their issue. Why is it that they are perpetrating these actions? Why are they doing these things? We're not doing that. And so I think that if that switch starts to happen, that's another thing that's a part of the stigma. Once that switch might start to happen, then we won't see as much sexual trauma
Mhm.
as we do.
Well, I mean, that's a really, important and interesting thought. And so, because you have so much experience with this and seeing the results of the trauma and all, what ideas do you have, if any, about how do you even begin to approach that from the perpetrator side? Where would you begin?
Yeah. I think the difficulty is, and I've experienced this myself, is because most of the mental health field is female, right?
Mhm.
The majority
Yep.
of therapists and clinicians and social workers are female.
Mhm.
And dealing with someone who is a sexual perpetrator and being a female and being alone in the room with them is difficult for a lot of people to grasp and to hold on, to wrap their minds around, because that is a safety issue,
Right.
right? And again, we're already in the world, and we have to deal with safety daily, right? And you don't want to have to deal with safety when you're doing your job. And so I think educating female clinicians on how to treat a sexual perpetrator would maybe be one of the first steps. And just even educating them on what it means, because a lot of the difficulty is in, especially if you've had those types of experiences yourself, right? You have a lot of bias when it comes to treating perpetrators. And you're like, well, they did it, so it doesn't matter, you know.
Mhm.
But most of the time, there's an underlying cause, whether it's they've experienced it themselves, or they might be psychopathic or sociopathic, you never know. But that's very rare that happens, right? It's
Mhm.
usually because there is some type of traumatic experience that they've had themselves, whether it be they've had their own sexual trauma, and because of the stigma of being a man, right, and not having, or not supposed to have, you know been a victim of something, that's difficult for a lot of them to admit.
Mhm.
But it's more than likely that's the cause of it. And once women or female clinicians start to understand what's at the core of sexual perpetration, they may be more willing to treat it. Yes, safety is an issue sometimes, but most of the time when you're treating them, they're at a stage where they've already been um, punished for what they've done,
Right.
right? And one of the places that we would have to go is maybe in the prison where they are, and that's another safety issue. So I think just getting the right information out there and understanding what the cause of it might be, and trying to get to the core of the issue, might be
Mhm.
something that could help to bridge that gap between
Right.
you know the services that we offer and being able to help people who actually need it.
It's a complicated issue.
Oh, absolutely.
Yeah,
Absolutely it is.
and then you run into questions of who's going to fund it and who's going to
Right.
do it and who's going to oversee it, and
Well, that's the biggest thing.
yeah.
The funding, because there's no money in treatment.
Mhm.
There's no money in cure. There's money in prison. There's money in rehabilitation programs, but
Mhm.
there's no money in, we actually want to help you get over this problem.
Right.
So the
Well,
society that we live in makes that difficult to
yeah,
do.
no, but it brings to mind, I don't know what, if anything, they have where you live, but where I live, we have what they call drug courts. And it's a specific court that is designed for people who are getting in trouble because of their use of drugs.
Right.
And if the person is someone who I don't know the exact requirements, but I think it's something like they have to acknowledge that they have this issue and they want to address it. The way that they run the court program is very supportive of them receiving treatment and addressing the root causes and treating them as, human beings that are trying to overcome a problem versus just pure punishment.
Mhm.
And I've gone and I've watched some of the sessions. I even interviewed the judge. And it's interesting because there are people that are caught up in drugs that, want out. They don't know how to get out. They're getting themselves in trouble because of it. But when they're treated in this type of program, they have success and they're rewarded along the way, and they're encouraged, and they're assigned to someone to help them, work through their issues. There's others who, they fail out of drug court because they're not truly ready or whatever. But I'm wondering if there's not a similar type of, potential option when you start talking about, perpetrators of sexual assault and those types of things. It just sort of came to mind as you were talking about it.
Yeah. I mean, I wish there was.
Yeah.
But the same issue with drug court will probably be the same issue there, because everyone is not treated the same, right? Depending on the demographic,
Yeah.
and a lot of people are given opportunities to go to drug court that are not necessarily people who need it.
Mm-hmm.
So, and I'm speaking specifically because, I'm African American, so I'm speaking specifically about African American people.
Mm-hmm.
From what I've seen and what I've experienced, even when I was a drug and alcohol counselor, that the treatment is not the same with regard to whatever the drug of choice might be.
Right.
Right. And like I said, I was dealing with CPS families, and a lot of times the families that were there were mainly families of color, and they were dealing with drug issues, right? Their children were removed from their home because of this.
Mm-hmm.
But another family of another demographic, that didn't necessarily happen. They were allowed to go to drug court. They were allowed to go to drug court multiple times, right?
Mm.
Where some of the families, the parents were put in jail, right? They weren't allowed to do treatment. They weren't allowed to do drug court. Or if they did do treatment, it was because, this was maybe their first time. But one of the things that I experienced too was the resources are not equitable a
Mm-hmm.
lot of times.
Mm-hmm.
And it's difficult for someone to do treatment that doesn't have a place to live, right? Or doesn't have food, or
Yeah.
doesn't have their basic needs are not met. It's hard for them to go to a treatment program. And so a lot of times that feels like they're treatment interfering because
Mm-hmm.
they can't get there. They don't have a vehicle, right?
Right.
Or they don't have an alarm clock to be able to wake them up, or they're working 3 jobs in order to be able to pay their bills, and they're working overnight, and they can't get up at 10 o'clock in the morning to go to a drug court program. You know what I'm saying? So
Those are all relevant things. Yeah.
yeah, I think that makes it difficult for leading back to what we were talking about, I think that that type of program, those types of same issues, I think would still exist.
Mm-hmm.
Because, school to prison pipeline is real. The fact that a lot more people of color are in prison is a real fact.
Mm-hmm.
And so trying to rehabilitate in this way makes it difficult for that to happen, for
Right.
the prison industrial complex to continue. That's kind of what I was saying about it's no money in treatment. There's money in prison. So if you're talking about, having that type of program where you get to go to treatment instead of going to jail, I don't necessarily think that because that barrier is still there, that might be very effective with people of color.
Yeah. No, you're pointing out a lot of the issues that we hear about when we talk about access and all these things, and those are obviously very challenging situations, and have been going on for years because they're so challenging.
Yes.
but at the same time, you are working with individuals who have been you know, who have trauma from some of these experiences. And
Yes.
we haven't talked a lot about that yet, which is, what do you see in terms of success rates, any particular interesting stories that you've learned about how to approach this? Tell us more about, you know, what happens when someone comes to you. They've got PTSD, they've experienced some sort of sexual trauma, they're looking for help. Do they get help? Are they able to improve?
Improvement, yes. Improvement does happen. Healing, not necessarily. And I
Okay.
say that because it takes a long time to sometimes just get to the core of the issue. Like I have a few long-term clients, one of them who I have been seeing for 3 years now, and she just now disclosed last year that she was sexually violated.
Oh, wow.
So I treated her for 2 years and she didn't say anything about it. And I was wondering, like, do you continue to come back to therapy every day for these 2 years? And that was what was at the core of why she wanted to seek therapy. But it took her 2 years before she trusted me enough, I guess, to be able to disclose that. And so the difficulty is in the time period, because a lot of people get impatient because they're like, oh, why can't I just get this off of me, right? Why can't I just work through this? And why can't it just take a few sessions in order for me to get through it? And it's not that easy. It's not an easy or short process.
Right.
And a lot of times people don't want to, not people, but clinicians don't want to spend that amount of time with someone, because that takes, you know, dedication. It takes you seeing the same person for you know, once a week for years. And a lot of times that looks like you're not making any progress, because, you know, that's generally what we've been told. You're not supposed to have somebody in therapy for 10 years because that means that they're just coming to talk or have a conversation. They're not making any progress. But that's not true for people with trauma.
Right.
Because it takes a while to unpack what is actually happening to them.
Well, so in your experience, would you say that some of your clients maybe don't have the awareness yet of what happened, or don't have insight? And the other question is, do some of them like blame themselves, so they're not going to bring it up because they feel that they were responsible? Tell me more about that side of it.
All of those things. All of those things happen. Most of the time, it's not necessarily awareness or insight. It's more of emotional connection to what has happened. Meaning, I know it happened. I can give you details, but I'm not connected to it. Like my experience with it is that was someone else. So
like
I don't know.
dissociating.
Yeah. Oh, absolutely. Dissociation is one of the biggest symptoms of PTSD. They're completely dissociated from the event. They're completely dissociated from that person. You know, sometimes people say, oh, that was the old me, and that's my old life. And they're not integrated to the point of where they understand, no, that's still you, right? Because the time that someone stepped on your foot and you screamed at them and you pulled out a knife, that's part of it, right? That's not just, you know, what used to happen or what happened to you when you were a child. This is affecting you now. And that's one of the things that people don't understand is you bring that all of those emotions with you. You carry that into your adulthood. And people think it's like, well, this thing happened and that's what that's what the PTSD is from, because I'm remembering this thing. And that's not it at all. You're trying to avoid that thing. You're trying to avoid that memory. You're trying to avoid that event. And that's the reason why all these emotions are coming up, or why you have extreme reactions to things. And I think that that's the part of it that people don't have insight about is that what is happening now is because of that,
Right.
what happened back then.
I'm just thinking, if I was a person who was a potential client, it sounds like it could be scary to go through therapy, because it sounds like I'm going to have to face these things that I'm so desperately trying to avoid.
Absolutely. That's the biggest thing, is fear. So yes, insight and awareness is there, but the fear of not just having to deal with these things, but having to think about them every week for an hour, and what happens to you after you leave the session, because that's a lot of times what people don't necessarily think about. So I always give a disclosure in the beginning. This is probably going to be the hardest thing that you ever have to do, because you don't deal with these emotions on a daily basis. You don't deal with these things in your daily life, and it's going to affect you. These things, once they start to come to the surface, your life is going to change. You are going to change. You're not going to even know who you are anymore, because you've lived as this person. You lived as this personality, and now you have to deal with the fact that this is not really who you are. People have identity crises all the time when they're dealing with their past trauma, because they've lived it with their pain. And now they're getting to a point of where their pain is starting to lift, and they don't know what to do with themselves.
Right.
They don't know how to identify. They don't know how to live anymore without this pain. And so they hold on to it because that's a part of their identity. And so breaking that down is even harder to do. Because how do you now tell me I'm not this person that I've been living as for the last 40 years?
Right.
That I am just someone who's been dealing with or navigating through my pain. And now that I'm trying to get rid of it, now I have to deal with what's left. Right. And I don't know who that is.
So then that, begs the question, if someone is going to have to go through all that and experience all that, is it worth it in the end?
I ask that question a lot. And I ask the clients that question too. Like, do you feel like it's worth it? I had a client one time who was, I think she was 65, and she'd had 40 years worth of abuse, like physical abuse, emotional abuse, sexual abuse, for 40 years, but she's been able to function. And so I didn't want to treat her trauma, because that would have opened up a door that she may not have ever come back from. And so sometimes it's not. Sometimes it's not worth opening up that Pandora's box, because if you're able to function in life, unless it's, debilitating, or unless it's to a point where you feel like you want to change whatever your reactions might be, sometimes it's not worth dealing with your trauma.
Wow.
And I know people think that's weird to say that, because why wouldn't you want to? But if you've actually, because she was actually able to live a life, and she was actually able to thrive, even though these things were happening to her. And so bringing up those emotions and bringing all that stuff back would have just made her gravely disabled. Because I could see at some point that whenever she had to deal with this, it was difficult for her to come back from it. It was difficult for her to readjust. And so I told her, I said, I don't necessarily think that that's something that we need to deal with. Maybe we can deal with if you have a crisis, or, whatever is going on the surface, because trying to dig deep and go to the core of whatever is happening right now is probably not beneficial. It's probably more detrimental than anything.
Wow. That's heavy.
Yeah.
So what would be an example of a best case scenario, like someone who went through treatment and had a good experience, in meaning that they've achieved the goals that they wanted to achieve? What does that look like?
I can't say that actually happens. Because especially if you are someone of late age, because you are, like I said, like baseline for trauma recovery is 2 years, right? That's baseline. That it takes 2 years to get to a point of where you're starting to heal, right? And so if you're 40 plus years old and it takes half as long to get rid of a disorder as it took to acquire it, you're going to be living with that probably for the rest of your life. You're going to still be healing,
Mhm.
right? And so that being healed is not necessarily an expectation. It's just getting to a point of where you can function so that you can start to heal. And so best case scenario would be someone who's able to live their life and be able to access the emotions that they need to access and express them appropriately while they're healing.
So what is your best advice for someone who maybe is watching this video and they, have been subjected, they've been the subject of sexual assault and they are confused, unclear, not sure what the next step is? What is your best advice for them?
To be ready if you want to seek therapy. And how you know you're ready is if you are tired of what you're doing. Right? I mean, that's the best way that I can put it. If you're tired of the way that you are living, if what has happened to you that you are aware of and you recognize is affecting your functioning, then be ready to address it. And if you're not ready to address it, don't seek therapy for it. Because that's just, that might be more detrimental to you. If you are able to live with it, because it's strange for me being a therapist and saying this, but everyone is not disordered, right? Everyone may have some traits, right? Or they may have some things that may keep their functioning, that might limit their functioning, but everyone is not full on criteria based disordered.
Right.
But because you feel like whatever behavior you have is different from someone else's, that, oh, something's wrong with me. But sometimes we need to kind of do some introspection and figure out, is it that something's wrong, or is it just that it's different from the norm, right? Or what we would consider normal behavior. Everyone, and I tell people this all the time too, unless it's something that is stopping you from moving, right, or stopping you from living your life, it's not necessarily a disorder. And because, mental health is trending, and because it's on the internet and it's on Instagram and you see all these people and all these things, they're like, oh, I have that symptom, so maybe I have that disorder.
Right.
And I think everything is not necessarily traumatic, right? You may have had an adverse event and something may have happened to you and you have emotions and feelings about it, but you're able to thrive. Like I've seen that with a lot of children or teenagers specifically, where their parents are bringing them into therapy because they were molested when they were 4 years old, right? But they have good grades and they're able to have social interactions and they're able to do things that normal teenagers do. They have, hormonal changes and they have attitude problems and they're just being teenagers. But because they connect this thing that happened to them when they were 4 to whatever their behavior might be now, they're bringing them to therapy and they're saying, oh, you need to fix them because I can't deal with her. Right. But she doesn't even remember what happened to her at 4 years old. You're telling her this is what happened to her. And so now she feels like something's wrong with me because all these people are saying that this thing happened to me when I was little, even though it doesn't really affect me on a day-to-day basis. So unless there is something that is really stopping you from functioning, it's not necessary to always seek therapy.
Right. Wow. Well, this has been very eye-opening and, certainly delving much deeper into a field that I have not, dealt with much.
It's not exactly how we planned it to go.
No, but I mean, the whole purpose of these videos is sharing people's knowledge and education and viewpoints, and you know, helping people, connect with just information. So I mean, we're basically out of time, but let me ask, is there anything that I didn't get a chance to ask you that you think is important that people be aware of?
I think it's important when we're talking about stigma
Mm-hmm.
to not just understand what people may be experiencing, but allow them to experience it.
Wow.
Because a lot of times we want to fix it, right? You have this thing that's going on with you. Let me fix it. Let me tell you what you need to do in order to make it better. You need to go to therapy, right? That's the thing. But in order for people to be able to heal, they have to get through their experiences, and trying to control it or trying to fix it or trying to make it better is not always the solution. The solution might be allowing someone to experience what they're experiencing so that they can get through it,
Mm-hmm.
instead of trying to get around it or trying to make it better because you're uncomfortable with their behavior.
Right.
Right. And
Oh,
everyone's behavior is not disordered. Right.
right.
It could just be unique to their personality. That just may be how they function in the world. And it's not okay to tell someone that they can't do that because you've seen something on Instagram that said that they have OCD.
Right.
That's not okay to do. Allow people to have whatever experiences they have. And if they feel like they need to go to therapy, then okay.
Mm-hmm.
But we can't always put people in boxes and then try to determine how they get out of it.
Yeah.
That's
Well,
not fair.
that's that it's really important and interesting. There is that there's this tendency to want to believe that everybody should be happy all the time.
Right.
Real
And that's not
humans,
true.
right? We're not designed to be happy all the time. We're designed to
No.
sometimes be sad and sometimes
Yes.
be sad. And so if somebody sees someone who's not happy, we need to fix
You
it.
you need
And
to
that's
fix
not
it.
necessarily the case.
Yes. And that's another thing. Emotional expression is not trying to get happy. That means being able to be angry and being able to be frustrated and being able to be sad and being able to have a negative experience, because that's life. That's how life goes. And these emotions are there for a reason. Everything doesn't have to turn into something positive. One of the things that I tell my clients all the time is when we're talking about CBT and affirmations and trying to, think positively, absolutely don't do that. Don't think positively. Think less negatively. Right. And I was telling one of my clients, and she laughs about this all the time. I said, you talk about how you're ugly or you feel ugly. And I said, well, okay, you feel ugly today. Right. But tomorrow might be something else. So think less negatively and then you'll get to a positive space. But if you
Right.
try to jump from negative to positive, that's absolutely not going to work.
Yeah.
You are going to have to experience your emotions at some point. That's what's called being human. So like I said, just allowing people to experience what they need to experience, even if it makes you uncomfortable, because seeing someone crying in the grocery store makes people uncomfortable, but
Yep.
allow them to cry because they might need it at that moment.
Right. Right. Well, that's, very, realistic approach, which is important for people to
Yes.
think about.
Mhm.
So, well, Rabiia, I really appreciate you taking the time to join me and to share all of this information and to share about yourself and your own anxiety. And, it's just good information to be out there and for other people to hear. And, if you're someone watching this video and you're experiencing some of the same things, take a listen to what was said, and hopefully that gives you some ideas of how to approach, whatever your own next steps are. So thank you for your time, Rabiia. I really appreciate you.
Thank you. Thank you for having me.